I'm Mike Belcito, co-founder of eFuneral, and I wanted to talk for a few minutes and answer some frequently asked questions that we constantly hear and see that people are making about hospice care. And the first question that usually starts everything off is, well, what is hospice care? And it's important to understand what it is and what it's intended for. Hospice is not a place, but it's actually a type of end-of-life care that's offered to individuals that either have a terminal or life-limiting illness. And it includes medical services, emotional and spiritual support and resources, and essentially it's meant to provide some level of comfort for people that are at the last stages of their life. So people that are usually in hospice care, they have a life expectancy of less than 6 months, and it's all about really trying to make that individual's last few months of their life be about comfort rather than being in the hospital hooked up to IVs. And really it's not about curing anything at this point, but it's about providing comfort. So who chooses hospice? Well, the goal of hospice care is really to keep patients comfortable and improve the quality of their life while they're dying. So people that are interested in ensuring that the last several months of one's life is a life of comfort and months of comfort rather than constant tests, those would be the individuals that might choose hospice care. It's not about giving up. It's about making sure that, again, the moments of that individual's life is going to be about comfort at this point rather than anything else. Now, where is hospice care provided? That's a question that comes up. Some people maybe make the assumption that, what does that mean? I have to take my loved one and now admit them to a hospice care center. Not always the case. Now, there are hospice houses that do exist that are specific destinations that are meant to provide hospice care for patients. But hospice care can be provided at home, whether that's an individual's house or, for instance, the nursing home that they're taking residence in. So hospice is really, again, not about a place, but it's a type of care that could be provided in many different places. Now, who's involved in hospice care? Now, sometimes people might think, well, gosh, because now we're not talking about curing a disease, does this mean that doctors aren't going to be involved? That's actually not the case. In fact, hospice care involves nurses, doctors, other medical professionals. It involves social workers that work with not just the patient, but also the patient's family to help deal with some of the issues that they will have to deal with at this point. And also chaplains that work with families with all different faiths that can help provide spiritual care and resources to them. So those are the types of individuals that are involved. It's a plethora of medical professionals that are actually going to be involved with both the patient and the family as well. Now, another common question that comes up is, who pays for hospice care? Now, some people don't realize, but there actually can be very little, if any, out-of-pocket expenses when one enters hospice care. It's actually a benefit that's typically provided by Medicare and Medicaid and often private insurers as well. So they'll cover hospice care generally. So that's something to look into, especially if it's something that you're expecting to utilize for whether it's yourself or a loved one in the coming months. So those are some general questions and answers about hospice that we typically see. Certainly, you could. There's actually a post that we've created in the past about Q&A on hospice, so we didn't invite you to check that out. It actually links to the National Hospice and Palliative Care Organization's official website, where they go through even more Q&A on hospice care, and certainly for other resources that we've made available on the topic. You could find those at efuneral.com/resources, or you could find them on our official YouTube page at youtube.com/efuneralresources.